Hey Columbus, this is Troy with Ohio Men's Health. Hey, today we're going to be talking a little bit about some of the most common basic things that we see here as the most top-rated testosterone replacement therapy clinic here in Columbus, and some of the most common symptoms that we see, some of the most common complaints that we see, and then talk a little bit about the nature of how do we uncork or unpack what it is that might be contributing to the symptoms. So first and foremost, if you're new to testosterone replacement therapy or men's health in general, you might have heard a bunch of commercials on like the radio, you might be seeing a bunch of stuff across your Facebook feed. There's a lot of information out there. The majority of it's actually pretty good. But here first we're going to talk about just some of the main symptoms that we see with men over the age of 35 most commonly as we start getting into what's called male andropause or early low testosterone. So our most common symptoms that we tend to see with men as they walk in are, number one, fatigue. Just our daytime level of the ability to have good vitality and good sustained energy throughout the day is poor. Oftentimes we see a dip in the afternoon with energy. Number two is what we can start to see is some sleep disturbance, where the quality of sleep just becomes disrupted. Sometimes it can be difficult to fall asleep. It can be difficult to stay asleep. Once we wake up, our mind can start spinning. And some of that can be just part of the life stressors that we have with our busy American lives. But low testosterone certainly contributes to some sleep disturbance. Now, number three that we start to see is reduced sex drive, where in our 20s, our late teens, our sex drive is really high, and as testosterone becomes more and more deficient, we start to see that our interest level in intercourse begins to decline. And for those of us that have been married for a long period of time, that can begin to cause some problems in the relationship, no question. So the sex drive goes down, and then we can see that the erection quality might change. For most men with low testosterone, it can be where we just don't see the firmness or quality of an erection that we used to when we were younger. We can still engage, we can still finish intercourse, climax, all those things still work. It's just that we just don't see the firmness or quality of the erection like we used to. For some men, there can just be outright erectile dysfunction where there's just very, very difficult problems achieving and maintaining erection throughout intercourse. That can be an issue. Some of the more common ones or less common ones that get overlooked are the exercise tolerance, the recovery from exercise, especially our HIIT training, harder exercise, our more vigorous, long, sustained workouts. So we don't tolerate the exercise as well, meaning that we just don't have that engine or that motor to get through some of the sustained exercise, longer physical exercise, CrossFit, Orange Theory, really intense, hard, heavy weight training. We just don't have the ability to tolerate that. And then the recovery is poor. So if we hit a day really hard, then throughout that day and into the next day and the following days, we can be extra sore. We just don't feel like we recover from the workout. And that's very common. And then with exercise, the other thing that we see is we just don't respond to it. Meaning in the gym, we just don't get that pump, that feeling of like that good muscle fullness like we used to, like that good pump. And then we just don't see change where we're working in the gym and we just go, gosh, I just don't see results like I used to. So that is very, very common with exercise, that where we just don't see the response, the recovery, we don't feel the pump, etc. with exercise. Now, other things that we begin to see as men is that as testosterone declines, we begin to see some of the visceral fat develop. So it becomes harder for us to burn the visceral belly fat, back fat. That also can begin to predispose us to some insulin resistance and prediabetes, and that's something we certainly want to evaluate as we're seeing you as a new patient or a new consultation, or as we begin working with you. We want to make sure that we evaluate that and evaluate it well, because that can be an anchor for some men. And if you're on testosterone replacement therapy and that's not being evaluated, and you're just not seeing the result as good as it could, that sometimes is the issue if we're not looking into that. Now, other symptoms we can see, we're gonna use this word, it's a medical word called dysthymia. Now, dysthymia is a term where the mood just becomes less excitable. So we're just not as excitable as we used to be, where, if you like to play golf and your buddies are like, hey, you wanna go golf on Saturday? And you're like, okay. Whereas before, like, you couldn't get your clubs fast enough. We're just less excited about life. Our mood just becomes depressed. Not that it's depression, because a lot of men get put on antidepressants before they come and see us. It's not depression clinically. It's sometimes just this dysthymic mood. We're just not motivated. We won't go to the gym. We see a lot of guys that come in are like, I used to go to the gym, but I don't have the motivation anymore. It doesn't feel good. I don't have the energy. So our motivation declines. Our mood just becomes depressed. We can also see some mild anxiety begin to settle in, where we just become generalized, just anxious about really nothing. We just become generally anxious with things. So we can see that, as well as some irritability, where with our partner, with our kids, with just our work stressors, we become just a little bit tolerant to some of the irritants throughout our day and our week. So these are our most common things that we see in terms of symptoms. Now, when it comes to evaluating low testosterone, I've been doing this 15 years. We've seen a lot of practices that pop up where you can walk in, you can get a testosterone test, you can do a take-home test, and they're looking at your total testosterone. And I get this call all the time where someone will call in and go, hey, my testosterone level, my total testosterone level's 400. And I go, okay, well, it doesn't tell me much. When you're evaluating hormones, there's about 15 other hormones we look at to make sure that we understand the big picture of what's contributing to the low testosterone, number one, and what's the formal diagnosis at this point, what's causing it. Because in some men, there can be causes of the low testosterone, and if we can find those and we fix those, that will correct the issue. Now, in some men, you might go on testosterone replacement therapy, or might have been on testosterone replacement therapy and go, gosh, I don't see, the results. I don't get the hype. It wasn't what I was looking for. It didn't work. Or as we begin treatment, if we have not evaluated thoroughly, there's a lot of little subtleties to hormones to create the balance between the total testosterone, the free testosterone, your estradiol levels, your insulin resistance. There's a lot of things to look at that help us really begin to create small changes with hormones so we can optimize your free testosterone, because that is really going to be the driver. And that's why when I see a lot of folks who come in, they talk about, hey, I got this total testosterone. I'm like, okay, well, it doesn't give me the entire picture. Where's the free testosterone? Where's the estradiol? Have we checked a prolactin level to see if there's any tumors? Have we checked some of the other complementary hormones that can make it difficult for us to not only transport testosterone, like your sex hormone binding globulin, but can we convert the testosterone into free and usable testosterone efficiently? And when testosterone replacement therapy is done well, those are the things that we want to consider, as well as other concomitant or other medical problems that can be contributing to the symptoms, because there are many other hormones that can also be out of balance that might be contributing to your overall symptom picture. And that could be cortisol, that could be your thyroid. There are many other hormones that we're going to evaluate and screen to make sure that we have everything balanced appropriately for you. So if you're considering testosterone replacement therapy or men's health in general, and let's define men's health, because this has also been a change over the past 5 years as I've seen big corporate America come into this space and create men's health as what we're going to call a testosterone mill. You go in, you get testosterone, you leave. That's it. It becomes a mill where it's just testosterone. Men's health is looking at the big picture with men. So as we age, and once we get over 40, we have some threats to our health. Our number one threat to our health, and our number one cause of death in men over the age of 40 is going to be cardiovascular disease. So we are going to also be taking a deep dive into your cardiovascular risk as a first step as well. We're going to be looking at that on our initial consultation. Number two, prostate health. Number two killer of men in our age group over 40 is going to be prostate cancer. So making sure that the prostate health is as good as possible as we age, and evaluating your family history and your prostate health, critical. Number three is insulin resistance. If we're not checking for insulin resistance in men's health, it's a huge mistake. I would say probably 70% of the men that I check on their initial labs have insulin resistance or pre-diabetes and didn't know it. I had a fellow the other day who was straight out diabetic, one of the worst I've ever seen, for 3-4 years as a new patient, and he hasn't been evaluated for it. And if we leave that untreated, number one, you're going to see subpar results if we just sling testosterone at you. And number two, that is a threat to your long-term health. And men's health is all about changing your long-term health. And if we look at your health long-term and we look at the amount of years that we get, that is what the amount of years that God gives you, that is your lifespan. Okay. Now in men's health, our goal is to evaluate all of those potential life-shortening issues and then try to change your health span, which is, I don't know how many years God gives you, but what I do in men's health and true anti-aging is we want to make as many of those years, as many years as we get good years, where we don't have chronic disease, we're not getting heart attacks, we're not getting strokes, our blood pressure is managed, our heart disease risk is low, our prostate health is as good as possible, and help us age as graceful with as minimal chronic diseases and medicines as possible. So if you're looking for a true long-term anti-aging men's health practice, we'd love to meet you. You can go to our website. You can go to columbuslowt.com. From there, you can fill out one of the contact forms. Let us know what it is that you might have an interest in, and we'd be happy to help. So you can go to columbuslowt.com. You can text or call 24/7, 330-662-1030. And of course, we would love to meet with you. If you have any questions, feel free to reach out, and we will see you next time.